Hey, it's Dr. Bob. I'm going to take you on a little tour of my kitchen today to get things started here. Don't get to see the whole thing because a lot of it's a mess. Just want to show you something interesting about potatoes. So let's head on over and let's just watch this here for a second. So I want to show you that we're going to my oven. Okay, so here we are at the oven. And as you can probably see, the oven is set to 500 degrees. And I've got in this oven, I've got a potato. Okay, you see that potato? All right, there it is. Okay, so I'm going to grab that potato. I'm going to grab that potato. Okay, and then, okay, we're going to take this right back over here. We're going to take this right back over here. Okay, get the dog too excited. That's good. Always good to get the dog involved. Okay, so anyway, this potato just came out of an oven at 500 degrees, and I wanted to tell you that it's possible to use mind over matter and not have it burn you or bother you. And why would that be the case? And why are we talking about potatoes in hot ovens? Well, the reason is that this potato was in an oven set at 500 degrees for about 1 minute, and the oven hadn't even heated up yet. And so when you heard, oh, there's a potato that came out of an oven set at 500 degrees, you're thinking, oh my gosh, that would be pretty hot. And the answer is, it would be, but actually, it's not. And so a lot of assumptions we have are not always correct. And that's what we're going to talk about today. So for instance, one of the things that we talk about is we say, oh, potatoes are bad, and simple carbs like rice are bad, and fruits are bad because they have too much sugar, and carbs are bad. But the truth is that cold potatoes, like this one, although probably better if it's cooked actually, cold potatoes and parboiled rice, like Uncle Ben's rice or other parboiled rice, and green bananas have a substance in them that's called resistant carbohydrate, and that means resistant starch. And resistant starch is not digested very well by our own digestive enzymes and bile and stomach acid. They pass through to the lower colon where they form a really good food for healthy bacteria. And so even though you say, oh, potatoes are bad, actually cold potato salad, not that bad for you. And what about rice? Well, rice may have a higher glycemic index than table sugar, but parboiled rice, like Uncle Ben's or other things you'll find in the same section at the grocery store, are resistant starch, and so are green bananas. And those things are very helpful to the microbiome. The microbiome, your gut bacteria, are key to your overall health. So today we're going to think a little bit about things that we might have mistaken assumptions on, or your doctor might have mistaken assumptions on about your headaches. So here's some questions to ask your doctor. Question number 1, are we sure this is migraine? Does it fit migraine criteria? Unless you're doing research studies with functional MRI scan or PET scans or something like that that light up certain areas of the brain, we use clinical criteria. So is the headache throbbing, one-sided, worse with exercise, moderately severe? Does it have 2 of those criteria? Do you have nausea or vomiting? Do you have light and sound sensitivity? You need 1 of those kinds of things to make the criteria of migraine that lasts 4 to 72 hours untreated or unsuccessfully treated. And you have to have like 5 or more attacks if it's regular, or 2 or more attacks if it's migraine with aura. So first, make sure you have the diagnosis right. Do you really have that? Does it fit that diagnosis? 2/3 of people have migraine that runs in their family who have that. So put all those pieces together, make sure you're really treating migraine. The second thing is you want to ask your doctor, you want to tell them about all the characteristics of your headache, and just go, I got migraine or I got headache. You want to know what kind of headache you have. One of the things that I see that complicates therapy the most is if a person has more than one kind of headache. So ask your doctor, could I have more than one kind of headache? So some people will have both migraine and cluster headache. And if they use just migraine treatments, they may overlap a little bit, but they aren't really going to get better. You think, well, cluster, that's like super severe. The average time it takes someone to get diagnosed with cluster headache is like 5 years. So question number 2 is, do I have more than one type of headache? Question number 3 is, could I have rebound headaches? My magic number is 9. Some people get it at less than that. Some people can tolerate more days of acute treatment without getting that. But in general, if you start to use 10 or more days of acute treatment, and especially if you get up to 15 days a month, then you're very likely to have today's medicine cause tomorrow's headache. So the big thing to think about is, could I have rebound? And if I do, How do I get out of rebound land? How do I taper my acute medicines? How do I limit them? What other kinds of things can I do? Because if you have rebound, both your acute medicine won't work and preventive medicines and strategies don't work. Then the next question you want to ask your doctor, and if you've had the same migraine for 40 years, it's probably not critical, but if you've just got a new kind of headache or you're just getting migraines, you want to ask, could there be a bad underlying cause? And so bad underlying causes come in 3 flavors. They come in fast onset, medium onset, and slow onset. So fast onset is over seconds to minutes, and that's like a ruptured blood vessel or something like that, like you're bleeding into your brain. And medium onset is like over hours to days. And that's something like a brain infection, like meningitis or a brain abscess or a sinus infection that's perforated through into your brain. So those are bad things to have. And then the slower onset is over weeks to months, are things like tumors that will come on. And so try to make sure that your headache's been stable, that it's been evaluated. Not everybody needs scans or everything, but everybody needs a good, thorough going over, a detailed exam, including looking in the back of your eyes for increased pressure, talking to you in detail to make sure you don't have any warning signs like focal neurologic symptoms, like one arm stopped working, or you can't speak right, or one eye doesn't see well. Unless you have some other explanation for that, then you worry that maybe there's an underlying more severe cause. The next question you want to ask your doctor, you want to ask your clinician is, are my medicines getting into my system? Because one thing that migraine does is it paralyzes the GI system so your stomach doesn't empty. And so if you dump a bunch of meds in there and there's just stuff sloshing around and it's not really being digested and it's not being moved to the bowel where most of things get absorbed, then maybe you're taking the right medicines, but you're not taking them in the right form. If that's the case, you could use something for nausea or promotility to get the stomach working again, or you could bypass the stomach. Ways you could bypass it: use a nose spray, you could use an injection, you could use a rectal suppository, you could use a patch. There's a lot of different ways to get around it, but if you're not absorbing it, your medicine's probably not going to help you. The next question you want to ask your doctor is, could any of my other medicines be causing my migraine? If you wanted to go on and Google and look at all the different kinds of things that could cause headaches or make them worse, there's a long list. Some things can actually prevent headache and cause it at the same time. And so that means in some people they prevent it and some people they cause it. And you are a unique individual. So it depends upon what you're doing and what's going on and your individual reaction to that. Some of it's your genomics, some of it is just how your body processes things and how you respond to that. So you want to go over your other medicines, make sure you don't have something that's causing headache. Now, if it's your cancer chemotherapy drug and you don't want to die of cancer, you might have to put up with your headaches for a while. But if it's like a blood pressure drug and there's 20 other choices, maybe you'd want a different choice. Which leads me to my next question you want to ask your doctor is, can we get 2 for 1? So when I go to the store, they say, hey, you can get 2 organic apples for the price of 1. I go, great, wonderful, thanks so much, I like that. And one of the things I've always done in my private medical practice is I try to get 2 for 1. So if somebody's got migraine and high blood pressure, I try to pick a blood pressure drug that's good for migraine and that's also good for blood pressure. Same thing is true if they have depression. Say they have depression or anxiety and they have migraine, I might pick a depression or anxiety medicine or strategy or treatment or device or program that's good for blood pressure and good for anxiety or good for whatever else they have, as well as the migraine at the same time. So anytime you can get 2 for 1, that's generally a good deal. Then another question to ask is, if you have a lot of nausea, ask your doctor, do I need a separate medicine for nausea? Because sometimes we just say, well, we're already treating it, and so here's your migraine medicine. And there are some migraine medicines that also treat nausea. There are some nausea medicines like Compazine or Phenergan that are especially given intravenously, but otherwise just in higher doses or just given by the right routes, can treat both nausea and migraine. So Compazine, for instance, in the emergency room gives better relief of migraine symptoms than narcotics do. And so it's got its own set of side effects, and you want to decide sort of risk and benefit for each individual. But one of the questions you want to ask is, do I need a medicine for nausea if that's a big part of my migraine? Because sometimes nausea can be almost as bad or worse than pain in its own ways. Then the next question to ask your doctor is, when you're gone, who do I call? Because I've been in different size practices before, and I had a lot of headache patients, and sometimes I'd go away for the weekend or go away for a week on vacation, and my headache patients knew if they called my partners would go, whoa, I don't think so, headache, oh, no, I don't do that, no, you're not getting any medicines, no, you're not doing this. So what you want to do is you want to work out a strategy with your doctor, your healthcare provider, whoever it is that's taking care of you, and say, okay, I know you're not going to be here all the time, you got a life, you got kids, you got family, you got all, got to go to on vacation or whatever, but who do I call when you're not around? And do they know me? And do they know what the plan is? Can you write that down to my chart? Like, hey, Bob's pretty legitimate. He's had migraines for years, hardly ever gets headache, but once every 3 years he needs to come in for an injection of Toradol or whatever. And if that happens, put it in my chart. And then also talk to your partner before talk to the partners before you go away. You don't have to go in and see them, but you want your doctor to say, hey, I'm going to sign these people out. I've got notes in here. I've got 5 migraine patients that sometimes have pretty bad migraines. They need to come in for this. Your doctor's partner is going to be a lot more comfortable with that if it's a non-steroidal or composine type medicine than if it's like a high dose of fentanyl or some narcotic. And so that's something else to think of. And then the last question to ask your doctor, question number 10, is would a combination of medicines be better than a single one? So one of the examples I've used a lot in here is sometimes if you give a triptan plus a non-steroidal, so you might give Maxalt or Relpax plus some naproxen or ibuprofen, you get a better response, and so more people get better, they get more pain relief, and less of them have their headache come back. So sometimes we combine a triptan and a nausea medicine. Sometimes we combine a nausea medicine and a non-steroidal. And so ask your doctor if you're not getting complete relief, would a combination of medicines be better? So those are my 10 questions. Is number 1, are you sure it's migraine? Number 2, could I have more than one kind of headache? Number 3, do I know for sure I don't have rebound headache, and should I treat it if I do? You darn well should. And how do you do that? Number 4, are we sure that I don't have some underlying bad thing like a tumor or an aneurysm or an infection? Those tend to come on and get worse and worse and have localized or bad symptoms like seizures or focal neurologic problems. The next one is question number 5. Am I absorbing my medicines? Are they just splashing around in my stomach? Are they getting into my system where they're going to help me? Number 6 is, could any of my other medicines be causing headaches? So I've had about 2% of women who take birth control pills who get headaches from them. And so I say, you probably need another type of contraception because that's not a bad, that's a bad thing, not an acceptable thing to have. And sometimes it's a sign that you could get worse and worse headaches. You might even be at more risk for stroke or heart attack or complications of the pill. About 2% of women also get depressed from the pill. And so for other people, it's just like the best contraception ever. It lowers your long-term risk of ovarian cancer, makes your cycles regular and lighter, keeps you from getting anemic because you're not losing as much blood every month. But you want to know, could any of my medicines be causing my trouble? The next question is, can I get 2 for 1? If there are other medical conditions I have, can I have them medicine that might treat both of them, or a strategy? Maybe it's yoga. Like yoga will lower blood pressure. Certain combinations of yoga have been well shown to help migraine too. They've even been beaten some of the best headache medicines in trials that were 6 months or more. So it doesn't have to be a medicine, it can just be a strategy. Then the next one is, do I need a separate medicine for nausea? That's question number 8. Question number 9 is, who do I call when you're gone? And question number 10 is, would a combination of medicines be better for me than an individual one? That wraps up my top 10 questions to ask your doctor about migraine. So we wish you all the best. We hope you're getting better and better, and we wish you the best in your journey toward migraine-free living. Great to see you all. Be well.